The clinical nurse specialist doesn't do one thing, and the way clinical nurse specialists within the different areas of practice, whether they're working in clinics or in hospitals or in the community, they're going to be doing a different variety of things. And so it's not one streamlined role. You have so many options and opportunities to apply your knowledge. I first considered going back to school about 5 years into my first job working in the PICU. And at that point in my career, I was working as a staff nurse, I was working in different leadership roles as a charge nurse and also as a transport nurse. And I felt almost ill-prepared for the additional responsibility that I was taking on. So I really started to consider strongly at that point going back and getting an additional degree. Within the CNS program, one of my interests was to pick up more leadership experiences. And I had the opportunity to blend my program with some additional leadership courses. So in addition to taking business courses, budgeting courses, I also completed a clinical experience with an assistant director of nursing and was able to spend the entire semester with her observing what she did, how she advocated for her nurses, and what her leadership skills and techniques were in her role. Implementing change is not easy. You come out with an outline for what you want to implement and how it's this best idea and that you're going to be able to make such an impact for patients and for nurses. And then when you hit the ground with it, your plan, you discover, is so more complicated, and that it really takes an entire team to put the simplest change into practice. You need to have key stakeholders involved. You need to have buy-in from every single person who's going to be involved or touched by whatever change you're trying to implement. As a student, I've been able to witness what the challenges are and what the roadblocks and how you can prevent that from occurring when you're trying to lead system change in your own practice within your role. I certainly would recommend Hopkins. I think it's an incredible university. The faculty truly care about the students, and they do everything in their power to encourage them to succeed and to seek out and explore interests within their own professions. The relationship between the hospital and the university is very strong, and it opens up doors and avenues for both students and employees.